and we'll get started in a minute.
Okay, recording is started.
Okay, and that's perfect timing. So I'd like to welcome everyone to the monthly tranSMART community call. Just as you heard, meetings are recorded for offline viewing, so those will be recorded. So Rudy can make those available to people as needed. I think that we're putting up a YouTube channel. Is that correct, Rudy?
Yes, in the next couple of days it should be up.
Fantastic. Okay, let me see if I can make this work. Okay. So I want to give you a quick agenda for today's meeting. We'll run through very quickly a set of tranSMART Foundation updates to bring everyone up to speed on what's happened over the last 30 days. It's been a pretty busy month and a lot has happened. So we'll take you through that very quickly, and then Rudy is going to come online and will give us an overview and wrap up of the BioIT World event and some of the key happenings there. Kevin will come online and give us a quick overview of upcoming events. And then we'll have Peter Rice join us for a version 1.2 update, and then we'll have questions and comments. And I think we'll also have a couple of presentations in here that didn't make it on this slide. But Florian from Imperial College will be giving us a quick overview of the effort with UBioPred, and Yuran Wang, I believe, will be joining us from Bering Ingelheim and giving us an overview of some of the work that they've presented as well. In terms of the foundation updates, I wanted to bring everybody up to speed. As I said, it's been a very busy month. In terms of the foundation, we've made tremendous progress on establishing the things we want to do in our stand up the foundation phase of the business. Overall, we have formed our first member-driven board. Our board met on the first day of the BioIT World meeting, and actually the day before, and we had a great board meeting, etc. We also convened our first meetings of our code, community, and content committees at the BioIT World meeting, or at least in association with. We were in a hotel offsite. And we've been able to really get the governance structure for the foundation in place and up and running quite well. In terms of the current membership, we currently have 6 gold members. Those include Converge Health by Deloitte, Oracle, Pfizer, Roche, Sanofi, and Takeda. We have 2 silver members of the foundation. Those are Johns Hopkins University and the University of Michigan. And we currently have 6 bronze members of the foundation. Those include AssureX, Cognizant, the Institute for Systems Biology, One Mind for Research, Sama Technologies, and the Hive. And then we have a number of affiliate members as well. As we continue to build out the foundation, all of the foundation's operating efforts come out of the membership program. And we look to recruit additional members as we go forward. And I encourage anyone who's joining whose company is not yet a member to get in touch with me directly. That's Keith Elliston at transmartfoundation.org. And become members. And if you know groups that should be members, please get them in touch with me as well. We did convene our board in terms of the new board, the member-driven board of the foundation. We had a founding board of directors, which included a number of members that have continued with us, including our chairman, Gil Oman, as well as Lee Hood from the Institute for Systems Biology. But also including Brian Athey and Michael Braxenthaler as well. And that board placed our new board into position, and we had our initial meeting of that group on April 29th. In terms of the members of the board, just so everyone knows who's on the board, our gold directors are Jamie Dannenberg from Takeda, Brett Davis from Converge Health by Deloitte, Matteo Di Tommaso from Pfizer, Olivier Gien from Sanofi, Jürgen Hammer from Roche, and Jonathan Sheldon from Oracle. In addition, we have our 2 silver member directors. Those include Gil Oman, who is our chairman of the board, and Ken Pienta from Johns Hopkins. And then our bronze members, who were elected through a several round election process due to some ties, include Jim Burns from AssureRx and Lee Hood from the Institute for Systems Biology. Then we also have recruited 4 at-large directors to represent various aspects of our community. These include Hiroki Kitano from the Institute for Systems Biology in Japan and Sony Corporation. We have Ann Martin from the Innovative Medicines Initiative in Europe, Gerrit Meyer from Trait and CTMM, and John Wilbanks from Faster Cures and Sage Bionetworks. So we had a great board meeting. Our board meetings are held both in person and virtually with remote access. And we also had a number of observers present at the board meeting. I think we had a very good board meeting. We'd scheduled it for 90 minutes. We ended up going 3 hours. And those of you who attended the subsequent pre-conference workshop know that management was a bit late because we were just coming back from that board meeting. The other governance activity that we put together was the 3C committees. We had the initial meetings of these committees. Again, those are the code, content, and community committees. And if I run back to this slide, which Kevin has put together for us, the 3C committees are a very important aspect of how you all communicate with the board and with the management team here at the foundation. Ideally, what we have is that these committees, the chairs of these committees will report at the board meetings of the activities of those committees. The committees will also make recommendations to the board for various activities that we want to pursue in those 3 focus areas. And the management team is actively engaged with those groups as well in forming and managing working groups of each of those 3C committees. So this is really the way to become very much more involved and engaged in what the foundation is doing and help to set the direction that the foundation is moving. So please, if you haven't gotten involved in these committees already, please do. The committees were initially organized at the Paris meeting last year and then had their first formal meetings with their members at the BioIT World event. The Code Committee was convened by E.K. Go and Jay Bergeron from Pfizer. And you'll notice that each of these committees is co-chaired by a member of the foundation management team as well as a community member. The committees themselves are open to any member companies, and one of the member benefits of joining the foundation is that you get seats on each of these committees based upon your membership level. The Content Committee was convened by Brian Athey and Ciaran Usheron from Thomson Reuters, and the Community Committee was convened by Kevin Smith and Sherry Cow. And as I said, these committees engage with the Board of Directors and with the management team to really be the active working portion of how the foundation works. Each of these committees also focused and built the initial set of working groups underneath those. Working groups are open to any community members, not just members of the foundation, but anyone who would like to join in the working groups is invited to join. For example, if we look at the Code Committee, they formed 3 working groups: an engineering support working group, a product management working group, and an architecture working group. What we'll do in the future is we'll have the co-chairs of these committees give us a little bit of an overview of what their activities are, et cetera, at subsequent community meetings. I think overall, to give you that sense, I think we have everything here. The meeting objectives that we had there at these meetings at BioIT World were to formalize the mission and the charter, to identify and establish the working groups, and to recruit members to those groups. So again, I issued that recruitment call. If you have an interest in being on these working groups or being involved in the activities of these committees, please contact the co-chairs. In addition, the groups are charged with identifying 3, 6, and 12-month deliverables for these committees and working groups. We're very much a delivery-oriented organization and community, and I think having key deliverables for these groups is essential. And the key deliverable here is that in mid-June, these committees will be summarized for the management and for the board of directors. So at our next board meeting, there'll be presentations of the organization of these 3C committees to the board. So that's basically the governance update that we had over the last 30 days. It's been an exciting month. We have our new board in place. I think we didn't put a slide on this, but in terms of the board of directors, I wanted to add that we formed 2 key committees of the board. We have a finance and audit committee, and we have a nominations and governance committee. We were able to recruit two chairs for these committees. So Brett Davis will be leading up the Finance and Audit Committee, and Matteo Di Tommaso will be leading up the Governance and Nominations Committee. And then together with our chairman of the board, Gil Oman, those three will form our executive committee of the board that will meet on a monthly basis to ensure that we have the governance that we need as a management team moving forward. With that, I'd like to turn this over to Rudy Potenzone, who's our VP of Marketing, and have him take you through the key events that took place at the BioIT World event and some of the outcomes of that. So, Rudy?
Thank you, Keith. I think you're going to have to move the slides for me too when we get started.
I'll
Um,
do that.
so we had a really exciting BioIT World a couple weeks ago in Boston. A lot of participation, as you will see, and I'd like to just summarize briefly some of the things that happened at the meeting. Next slide. We had a pre-conference workshop that was attended. We had about 50 people registered for the session, but we actually had more people than that show up. And so during the course of the 4 hours, I kept counting, and we had between 45 and 55 people pretty much throughout the whole session. In fact, as you can see from this picture, we not only had standing room in the back, but people were sitting on the floor. So it was very rewarding to see after a lot of work had gone into pulling this together. Next slide. We had 5 presentations where we talked about Keith did an overview of the foundation, talked a bit about the board formation and membership. EK previewed version 1.2, which is coming, and you'll hear more about in a few minutes. And then we had 3 presentations that went through the uses of the platform. And this is where it really starts to get exciting. I know certainly for people developing the platform to see it actually being put in use, at places like Sanofi, um, at Harvard. Paul gave a really interesting talk showing some pretty aggressive uses of the platform. In fact, Paul is working with us. We're going to be putting together a recording of this session that he did. And then Brian described a very interesting collaboration between the University of Michigan and Johns Hopkins. Um, Unfortunately, we tried to video this and it didn't. We had difficulties, and so we were unable to do it. So we are collecting the PowerPoints, and those will be available shortly on our website, which, by the way, is being redesigned, and we'll have a lot more information shortly. Okay, next slide. Just a couple of pictures of the presentations going live, and again, it was pretty very interesting session and a lot of participation, a lot of questions from the group who attended. Next slide. We also like to thank our sponsors for the event. Gene Data, IDBS, and British Telecom BT were all sponsors for the event, and Gigaspaces did provide a break session for us. We'd like to thank them for their help. Next slide. The We had a community meeting, one of these meetings, but intended face to face on the Wednesday evening. We had 100 people registered, and pretty much everybody showed up. It was a dark, rainy, dreary night in Boston. Unfortunately, the Deloitte offered us the use of their facility, which was about 2 miles from the event, and still everybody made it over. And so we again thank them for their help in putting this together. Next slide. The agenda we show here, it really was a focus on the 1.2 release, which is coming. And EK went through an overview of the release. And then a few of the groups who are actually creating some of the features and capabilities were able to present and show screenshots in some cases recorded videos of the actual features as they're coming in and being put into 1.2. Genome-wide association studies, browse and search, genome browser, a number of things that the Dan Hausman showed us coming together. So it was really exciting again to see these all being brought forward and actually working in what's coming together as the platform that we'll talk about. and see shortly. And then Axel and Jonas did what you should never do, which is try to do a demo of an alpha version of the product, and actually it worked with the machines running in London, and it was really exciting again to see. Next slide. This shows this meeting. You can see across the top there, that's not 100 people. It's more like about 50 or so. But this was at the end of the night at 9 o'clock in the evening after a couple of hours of talking, and a lot of people had already headed out into the rain, but we still had a very strong crowd. You can see the middle slide there. Very, very exciting. And the two guys who actually did the demo of the alpha product actually were quite relieved to see it go so well. Next slide. At the BioET World itself, we had 5 presentations. Again, mostly the focus was on research groups who are actually using the platform and talking about some of the results that they're getting, some of the new capabilities that they've built on the platform. Those of you who attended will be, I believe a lot of these will be available for you from the BioET World group, and you could also obviously contact the authors if you have some interest. Next slide. It's always gratifying, though, when you come to these things and actually see the platform based projects actually winning awards. And we actually got 2 awards for some of the presentations, and one presentation, one project, and one poster. Next slide. You'll see that we got a Best Practice Award. The U BioPred project was awarded Best Practice for Research and Drug Discovery. And Keith, Jonas, and Ike accepted the award for the project. And Jonas will actually speak in a few minutes and describe it, the project for us. Next slide. A poster by Yurong and his colleagues at Baron Regelheim and Ceramon and the folks at Thomson Reuters won a Best Poster Award. And Yurong is going to speak to us this in a minute. So I think overall, hopefully you would agree that we had a really good meeting. We had a very good showing, and there's a lot of interest and a lot of excitement about the foundation. And I think now we'll turn it over to Jonas, who will talk about his winning project.
Okay, let's see if we can get Yanni activated here. Yes, I'm trying to find the list. Yanni, where are you? Oh, it's not Yanni that's going to present? Is it Florian is going to present, right?
Yep.
Yeah, there's Florian. Okay,
Florian. Sorry about that. Yep.
Florian, are you there?
Yes, I'm here. Hello. Yeah, unfortunately, Yanni is on a travel in Berlin, and he was trying to get on here, but he couldn't get it. So I'll try to match him. No one can really match Yanni, but I'll try to go through the presentation myself. That I know technically, so I wouldn't have too much insight on the data and everything, but technically I know the project. So I'll try to do that. You have the slide, I suppose.
Can you see the slides now?
Yes, I can see the slides now.
I think I'll have to do them for you. I'm not sure. I'll see if I can give you the mouse. I can give keyboard and mouse only to Rudy. I'm sorry. So.
No, it should be fine. I mean, it's really not that long. So,
okay.
As a first slide summary, so for the people who don't know UBioPred, it's a project that aims to look at severe asthma and trying to discover some biomarkers and new eventual element that could help us to describe asthma in its heterogeneity. So we do have a couple of challenges. So if you go on to the next slide. So it's a project that is definitely driven mostly by academics, but we do also have pharma companies and a couple of other organizations aside that do a bit of work, the collection and everything. If you go to the next slide, we'll see a couple of the challenges that we faced. So the idea was to collect a different type of omics data and integrate them all into a single platform for 2 different groups, so the adults and the pediatric groups. A lot of things got collected through ECRF in hospitals, and then we wanted to emphasize as well on the collaborative side of it for all of what was regarding to hypothesis management and provenance of the hypothesis, as well as the provenance of the data. And for that, we actually proposed a solution. So if you go to the next slide, of course, the big element in that is tranSMART. So that's the platform that we choose for UBioPred in order to collect all of the omics data and be able to run some very basic analysis using the platform. We've curated a couple of data sets onto it. So if anyone has a question regarding to this, I will have to direct you to Yanni, who is the data manager, as well as the person who was in charge of putting up all of these data sets together. And also aside, if you go to the next slide, we've created in-house a knowledge portal that, as I said, was supposed to handle all of the other topics that I mentioned, like recording hypothesis and the commenting of this hypothesis, putting some metadata on it, handling all of the raw data that we use in the tranSMART instances, and that for all of the researchers openly available to use so that they could exchange their work, they comment their work, and we avoid all of what is redundancy and mistakes into the protocol of these different experiments. So if you go on the next slide, you have a quick view at what the knowledge portal looks like. So this is what a typical investigation page looks like, where the different researchers come around, propose their hypothesis, and then they describe the cohort they use. Everything is linked with tranSMART as well, so we can go from there up to tranSMART and replay the analysis that a specific researcher has been doing. And then people are able to potentially comment and exchange on the different hypotheses and the investigations that are going on. And all of that is logged, of course, for data provenance and audited as well, so that we can make relevant decision regarding to how to improve the platform at the end. So if you go on the next slide, you'll see what the data flow is in UBioPred. So from the model and the clinical sites up to the two different parts that we use, including tranSMART and the knowledge portal. So as you can see, we have this link in between the knowledge portal and tranSMART that allows us to sort of put data in from one to the other and vice versa. And then I think on the last slide that you have, there is a couple of pictures, but I think Rudy already told a lot about it, so I think the pictures explain by themselves. I wasn't here, unfortunately, during the award, but we can see that Keith, Yanni, and Ike were pretty happy about this. So if there is any question, I think there is a question section at the end, so I think I'll leave it there for now, but I'll stay around.
Yes, we'll hold questions at the end, but that was a great presentation for him. Thank you. And I have to say that we were really excited about that. It was fantastic to see a project like UBioPred that has been so closely associated with tranSMART, with the foundation, with the version 1.1 of the platform. To be recognized that way. That was fantastic. Great. Okay, let me see. Next, I think we have Yuron. Let me see if I can find Yuron and activate him. Okay. Yuron, are you with us? Hello?
Hello? Hello,
yes, we can hear you.
Great. This is Yuron. Thank you so much for the opportunity. It's a great pleasure here. I guess you will have to advance the slides for me as well?
Yes, I will, Yuron, but just let me say next slide and I'll be right up with you.
Absolutely. So could you flip the next slide, please?
You want me to?
You can probably, step through that. That's from the original presentation for the BioIT Award. The project we were doing basically was try to build scientific question right into the tranSMART. The current tranSMART allows most of the bioinformatics can easily answer all the questions they want, but for bench scientists, at least in BI, they have some troubles to understand the tools and take a little longer for the training. That's, we discovered some of the limitations that's listed here. That's again for 1.1. I know our new version addressed some of the issues already. We discovered that those limitations, and we work with tons of others to come up with something much easier for bench scientists to do. That's the goal for the project. So next slide, please. Okay, sorry. You have to flip through that again. So what we came up with, we surveyed the scientists, work closer with them to come up with these 7 questions, biological questions they commonly ask. They should cover almost like 80% of their day-to-day analysis. Say, what kind of question you want to ask given this type of data along with the metadata. So we came up with these 7 questions. Based on those 7 questions, we designed a workflow system to answer those questions. Next slide, please. This is example of one of the questions, how the workflow goes. So the workflow is very similar for all 7 questions. The very first is you select what kind of question it is. Secondly, you select what kind of gene or gene signature you want to integrate it against. Then you select what kind of data set coming from the tranSMART system. It can be a single data set or multiple data sets. It actually can combine from microarray data as well as NGS data. And after that, it's optional. You can choose clinical parameters or not. And depends on the input, you click the run analysis, it will give you different type of results fairly easily. And the results presented are also visualized in JavaScript. That's taken from other projects. Hence, we make it more interactive rather than the R script graphs. So next slide, please. It's taking a while to load on my screen. Sorry. This is just a work screenshot of the system we came up with. Basically, the entire screen was are break down into different sections. So there's main working area where you choose the workflow. Then later on, you choose the gene signature datasets and also other options. On the right-hand side, on the top portion, you will see it has a content-based helps. Depends on where you select, it will explain what the workflow is, what the steps are, basically what you're doing there. Give you a hint, so that reduces the training time to remind people what's this for. Then again, the bottom portion of the system are previews. So it tells you, step 1, you select what, step 2, you select what. So next slide, please. So second steps, you have a choice to type in a gene or a gene signature. You actually can add multiple genes or gene signatures. That's a slight enhancement over at least the version 1.0 tranSMART. You also, depends on what kind of workflow you choose, you might not need to choose a gene signature. You just say, I want to work with the entire data sets. Again, like you said, like you can see here, the preview window add a step 2. Next slide, please. Here you choose what the data sets you want to work with, which data sets you want to work with, and you can choose 1 or multiple data sets. The common, it depends on the curation, the common clinical parameter will show up in the next section. So next, please. All right, I guess this skipped the optional clinical parameter choice and shows the final results. As you can see, the final results a little bit too big to fit into one screen, but it shows. That's okay. I'm sorry. That's okay. The results is shown up as a heat map, similar to the stock tranSMART version, but it also has become an interactive heat map, so you can select the portion of the heat map, and some of the z-score values actually show up on the right-hand side. And from the right-hand side, you can see there's a couple more buttons. One, it can explain the workflow itself. It tells you initial parameters, shows you what, have a pop-up window, shows you what exactly parameter you choose for the analysis. You can also save whatever you selected, the gene list here as a signature goes back to another round of analysis, so that's very convenient. You also have another button is little cut off here, say run enhancement. That's actually a building function we took from Thomson Reuters, and they will allow you to check some of the enrichment analysis right from this screen. Very medical analysis, very, very convenient. Next slide, please. I'm still waiting for the, okay. Here it goes into some of the discussion and conclusion for the system. We already have over 100 high quality data sets in our system. We call it BSMART. There are private and public data sets there. They also have micro and NGS data in there. We are working on to see if there's different workflows we can create it based on the user usage. We also aware the new, I'm very excited to hear about the new version 1.2 coming out. We're trying to see if we can integrate that quickly with our system, and hopefully we can release some of our code back into the community if approved by the company. So next slide, please. Oh, that's the team. And unfortunately, I don't have a picture for Thomson Reuters life science team, but thanks to them, this is a truly team effort, and we're making it happen. And I will take any questions if you have.
Oh, fantastic. Let's leave some questions to the end. But that's a great presentation, and it's actually a great introduction to the next thing we want to go through. So let's leave questions to the end, and we can bring everybody back, and we'll move forward from here. Thank you very much, Ron. Okay, I think we were going to talk through a few upcoming events. I think Kevin was going to take us through those. Let me see if I can activate him. Find Kevin. Kevin, are you with us?
I am here. Can you hear me?
I can.
All right, excellent. So the upcoming events between now and October are showing on the screen. You'll hear a bit more about the testathon that the foundation is organizing. We have 2 cycles that are planned for June 3rd through 5th and June 10th through 12th, so that is in about 2 weeks. Following the upcoming testathon, Dr. Athey, who's our Chief Science Officer for the foundation, will be presenting in San Diego at the Bioinformatics and Pharmacogenomics Conference. So those who may be attending the conference or in the area, I'm sure Brian would dearly love your support. The foundation is also organizing a set of launch activities that are being planned for June 23rd, which is the week following the release of version 1.2. And Rudy is taking lead on that, and we'll be reaching out to the community with more details as they become available. And then we finally have tentatively set our date for our annual face-to-face community meeting for October 15th through 17th. This is a Wednesday through Friday, and we are firming up details, but the location looks to be Baltimore, Maryland at Johns Hopkins University, and we expect to be able to firm that up and communicate that out to the community later this week.
That's great, Kevin. Fantastic. Thanks, Kevin. And like as you said, one of the nice things about this week is this is a Columbus Day weekend, and so we want to make the 15th to 17th work. I think that's Wednesday through Friday. So the way we also will have this run is our board meeting will be in person the day before that event, so on the 14th for any board members that are in attendance. Okay. With that, I'd like to turn this over. I think who's taking us through this, Kevin? Is this Peter?
It is Peter.
Okay. Let me find Peter online, and we'll turn it over to him. There's Peter. Peter, are you with us?
Yes, I'm here. Can you hear me?
We can. Fantastic.
Okay, I was given a slot to show some of tranSMART 1.2 in action. I've got some videos that Axel had prepared for BioIT World, so I'll take you through those. The videos are going to be showing several thousand miles away, so I hope I can stay reasonably in sync with them. I'll do my best.
Well, we'll give it a shot.
Okay, if you could zoom through to slide 48, I guess. That's the one. And then should be a video there. There we go. So this is the new interface for 1.2, which has come from Sanofi. So that's the Dataset Explorer. It functions much the same way, but in a much more friendly view. There's a group view that includes samples. Some new workflows have been added by Hive and others. So there's some new analyses coming in 1.2.
I feel like I'm running it right here, Peter, the way this is going.
Yeah, that's right. It's working the same way it did last time I watched this. Data export shows you that the various data types, there are a multitude of new data types. You don't have to pretend everything's gene expression anymore. And I think that's the end of that video.
Okay.
Yeah, just skip forward another couple of slides. Yep, there should be one on there.
Okay. Oh, there we go.
Yep, so this is Sanofi's search interface. So you can organize things now by programs, by assays and studies. So here we're creating a new program to store things under. We missed a bit there. Yeah, here we go. So we create a program. This was done for BioIT World, so there's a BioIT World program being created with a description, and you can select various annotations. We'll cancel that, and somewhere here there's, as you can see, there's one real one here and a bunch of test ones. So we go for the real one, and then you can select the program itself. It has a set of tags associated with it, and then you can go down to the study, which has a bunch of provenance data you can attach to it. This is something you can define, or we could maybe automate. There are also files attached to it that you can export, and then there are assay descriptions within that. You can go to more detail, and you can extend this by adding assays, adding studies, adding more folders within folders, and organizing things in the search interface. And this is all then searchable through the browse. I think that's that video. Skip another 7 slides. There's one showing the workspace. I think the remaining ones say illustration at the top. Yeah, next slide. Here we are. So you can create quite complex queries and save them with descriptions in a user workspace. So we'll just go through creating one of these, selecting male and female by age, and with a couple of other categories in here. And then we can save that subset and give it a description. And then, having saved that description, we can then go and pick it up from this screen. So the next time we go into the Dataset Explorer and we'd like a subset, we can just go along the top here to Workspace. We can find our subset selection. We can click on Use, and it takes us straight in, and there we are. And then we can go in and manage our workspace, and we can update our descriptions. So we can maybe put a little note to say how easy it was to do, or put a note to say exactly what the subset was. You have a choice. And then there are a couple of videos showing, I think the next one shows the Dalliance browser from Hive. So if we just skip a couple more slides. Oh no, it's, yeah.
Is this the same one or is it different?
I think this is the same one.
Okay.
Yeah.
Hard for me to tell here. So that's 59. This one?
This one, yeah.
Right.
So there's a plugin from the Hive that adds the Dalliance browser, and you can then bring up a view of here chromosome 19 and scroll left and right, zoom in and out, and show other data as tracks on the browser. Which looks very nice to me. I'd much rather be working at this sort of level than this is familiar to me as a bioinformatician.
Yeah.
And then the final one is a Galaxy export.
Okay. Oops.
Next slide. Next one. Here we are.
This one.
So this is Axel's been working on export of data to Galaxy. So we can go in here. We can create some subsets, go into data export, and of course export data. And so here are some export jobs we've run earlier. We could then go into the Galaxy export and pick one of these, select this one, give it a name, and it will then export this data and pass it on to Galaxy for analysis. So you can make your selections in tranSMART, export them, and then use them in your own Galaxy workspace. So we're just running the export here. It started. We can go to Galaxy, and then here we are. The exports appeared at the bottom as a library in Galaxy, and then we can expand that library to the various components that we've exported, and they're recognized as tables here in Galaxy. And we can carry on and work with them. So that's a flavor of what we're promising for 1.2. We've got a deadline of the 20th of June, which is, I note, just after Brian's done his talk at San Diego. It's just after the next community meeting. So we're working very hard on getting things together for that.
Fantastic.
And having normally 2 calls a week. This is hijacking one of our spaces. So we'll have another call on Friday, and all the things we'd identified as problems on last Friday, I think, are being solved.
Fantastic.
We're doing very well. We're now concerned at the finer detail.
Well, I know the group is working really hard, and there's a lot of people in a lot of different places working on this. So we all really appreciate the efforts you have, and also taking some time out to show us what's coming. I think that's fantastic. Really appreciate it.
So I hope that's a useful taster for everybody that there are new things coming.
I think that's fantastic. It's a great survey of what's coming. Absolutely. Fantastic. Thanks,
okay,
thanks,
thank you.
Peter. Okay, in terms of the testathon, I think this was my piece to take people through. In terms of what we're planning and putting together is we're going to be hosting 2 cycles of testing, and we're going to be doing something a bit new this time. We're going to be organizing everything via a virtual hackathon approach. We have 2 cycles set up, one June 3 through 5 and the next June 10 through 12. There'll be activities happening outside of this, but these are the core dates for these efforts. We'll have probably 3 hubs we're looking at right now. This is still in the works, but certainly a major hub at Imperial College with Peter and Yanni and Florian and the whole team there with EK. We're working on a San Diego hub. Rancho Biosciences has suggested that they can do that for us, although the dates may shift slightly. And then IDBS has offered up a hub here in Burlington, just outside of Boston, Metro West Boston, for Boston collaborators. The idea is to have people that can come together physically and then have a virtual environment where everybody's working virtually across this. And what we'll be doing is working on a common hosted platform that we're working through identifying and fixing bugs on, and then cycling through as we go. So that's all in the planning stages. We have a number of groups that have volunteered effort, resources, etc. To help out here. I specifically want to call out BT Global Services that will again be hosting the infrastructure for us. And Oracle has also stepped up in helping us with understanding how we can do that so we can host a full enterprise Oracle version on the BT platform for our hosting purposes. We have Cognizant that will be providing a number of people to help in testing and bug fixing, Converge Health by Deloitte, the eTrix group, obviously, as well as the developers at Imperial College, IDBS, Pfizer, Rancho Biosciences, Thomson Reuters, University of Michigan, and I think Scott Clark from Samatech said that they could offer up some help as well. If you are interested in participating in the testathon, please contact Kevin Smith or me, Keith Elliston, and we will bring you into this mix as it puts together. The current plan for the testathon is to initially do all of our testing on an Oracle version of the platform, and then to move all those fixes onto the Postgres version of the platform. We think that that is the right migration path, and that's what the development team will be working on. So in terms of the release plan, we're working on a number of key events around the release, and Rudy and Kevin are working quite a bit on this. We have the great advantage of the 1.2 release cycle here, having Rudy coming and joining us with a lot of experience on software releases and helping us organize some activities around that. If you are interested in participating in those elements, please contact Rudy Potenzone at the foundation, and we'll get you engaged in some of those activities as well. I think I'm going to go back and make sure. Kevin, are you still on?
I am here.
Okay, do we have anything else that was to be presented, or should we go right to questions?
I think we can go straight to questions, but again, I think we want to reach out to the community at large. If you are interested in presenting your involvement around tranSMART, something new, something novel that we haven't seen before, just as you've seen some things today, we would really like you to reach out, communicate with us, and we'll work to fit you into our future calls.
Sounds good. I'm looking at questions. If you have any questions or you'd like to make any comments, please raise your hand on the webinar. I have a first question from Devin. Devin says, can you post the contact information for the committee chairs so we can reach out to them? Yes, we can. Is that on the website at all, Kevin?
Not as yet, but Rudy is working on that.
Yeah, hopefully by the end of this week, you're gonna see a lot more information, and so each of the committees will have their own section. And they'll be posting, things like the chairs, the working groups, and some of their goals and objectives. So hopefully that'll be on, and will continue to be updated. So hopefully by the end of the week.
Okay, fantastic. Second key question is more of a comment from Ciramon. I believe Dave Milberg is also presenting tranSMART in San Diego in June, the same event that Brian is as well. See if I can find Ciramon. Ciramon, are you on? Ciramon? I guess maybe her mic won't activate. I don't have a title or anything of that nature, but if you can send that to us, we'll post that up on the website. And anyone, let me put that call out to anyone who's making a presentation on tranSMART in any forum, any public forum, please send them to me or to Kevin, and we will post those on our website, and we will broadcast those out. We want to make sure that everyone's aware of the various talks and things that are happening that involve the tranSMART platform. Okay, I'm looking to see if anybody's raised a hand for a question or comment. Or if you want to post a question in the question window, we'll take that on. Anyone? Okay, I don't see any questions or comments coming. Kevin, am I missing anything?
I think we're good.
Okay, well, with that, 6 minutes early, we'll end the webinar. I want to thank everyone for their participation. Again, the webinars are recorded. Rudy is in the process of posting a YouTube channel that all these videos will be available on, and there'll be links to those on our website. Keep your eyes on the website. You'll see a lot of things added there, and in particular some of the contact information for the 3C committees and various activities around that. So again, thank you very much for participating, and we'll look forward to seeing you again next month. Thanks. And Rudy, you have the recording, so I'm going to let you end the session.
Yep. Thank you. Thanks everybody for participating, and we will sign off.